Hello, and welcome to the Health Bites section on how to breastfeed, where we'll talk about everything you need to know to start breastfeeding your baby. We'll also address many of the concerns new mothers have about breastfeeding, and we'll talk nutrition too. So let's get started.
In recent years, experts have come to agree that breastfeeding is the best feeding for babies. Research shows that breast milk is much better than formula at supplying all the nutrients a baby needs from the time she's born all the way to age 1. So now more than ever, mothers across the country are choosing to breastfeed. But the problem is, many women who want to breastfeed just aren't sure how to breastfeed. If this is true for you or someone you know, then stay tuned to this Health Bites News special presentation. Good evening, everyone, and welcome to this Health Bites News special presentation about how to breastfeed. I'm Lisa Miller. Mothers who decide to breastfeed are giving their babies the best, healthiest start possible. On this show, we'll visit a clinic as Martha Kindle, a lactation consultant, guides a new mother through the steps of breastfeeding her newborn baby. Later, we'll meet a nutritionist who will explore your diet as a breastfeeding mother. And we'll also talk about some of the concerns women have as they begin breastfeeding. So here to get us started is reporter Jenny Jones.
Thanks, Lisa. We're going live with lactation consultant Martha Kindle as she speaks with the new mother about the basics of breastfeeding and shows her a few common positions. Ms. Kindle is in her clinic with breastfeeding mother Danielle Stewart and her baby Holly. Now, Danielle started breastfeeding Holly in the hospital, but today she's getting more information from Martha on how to breastfeed. Martha, what should Danielle know before she gets started?
It looks like Danielle already has a good start. She's washed her hands and she's sitting in a comfortable area with pillows surrounding her so that she has that support. Her husband can help at home by taking care of the baby and making sure that she is happy while Danielle gets ready. And the first hold that we're going to talk about today is the cradle. The cradle is the most common hold. And all that you need to do is cradle the baby's head in the crook of your arm and making sure that the baby's nose is near your breast. And you want to support the baby's bottom with your hand and use your other hand to support your breast, just like that. Great, just like that. Positioning your baby correctly is important for getting a good latch. If you ever find that your baby gets sleepy during breastfeeding, there are a few strategies that you can try. For example, you might try talking to your baby. You might try massaging her arms and legs, or maybe even expressing some milk into her mouth, or rubbing your nipple against her cheek and lips. And of course, if none of those things work, then it's okay just to let her go ahead and enjoy her nap. That skin-to-skin contact is the best way to keep your baby alert while she's breastfeeding. The next hold we want to try is the cross-cradle hold. And that's where you use the other arm to support your baby's head and bring her near your breast, and use your opposite hand to support your breast, just like that. If your baby does not get a good latch, which it appears you have, she may try to bite down on the nipple or the areola, and if she does, you can contact a local healthcare professional or a WIC office. So the next position that we'll try is the football hold. The football hold is great for women who have large breasts or women who have had a cesarean section, and also for tiny babies who have difficulty latching. They seem to latch well in the football hold. So what you want to do is you want to hold the baby in your arms, supporting her head, and pulling her chin and nose near your breast. You want to tuck her legs between your rib cage and your elbow. There you go. And be sure to support the baby's head with your hand while you're doing this. Now, Danielle, Holly will feed for about 10 to 20 minutes each time you breastfeed. And when you do that, you want to make sure that you use the same breast for any one feeding. If you burp in the middle of that, that's great, but when you bring her back, she needs to go back to the same breast. And then the next time you feed, you can use your other breast. Another position that you might want to try is, you can do this at home, is lying on your side And all you have to do is make sure that Holly is lying on her side, facing you, with her chin touching your breast. And you want to support her either with a blanket behind her or your lower arm, and also support yourself with a pillow under your head. And then use your other arm to support your breast. As for how often to feed your baby, you should let your baby's hunger set that schedule. Newborns typically eat 8 to 12 times in a 24-hour period. So you want to be able to recognize when they're hungry. And you'll know that she's hungry because she will be more alert. She may be making smacking sounds with her lips, and she may be making a sucking motion with her lips. She may even be rooting, and rooting is just turning her head and trying to find your breast.
Well, it looks like Danielle and Holly are getting the hang of it.
That was very informative. But Jenny, I have a question. How can a mother tell if her baby's getting enough to eat?
Well, the best way to tell if a baby's getting enough is by her diapers. In the first few days after being born, a baby will have only a few wet diapers each day. But after a few days, a baby should have 6 or more wet diapers and 3 to 4 seedy-looking bowel movements each day. A well-fed baby will be gaining weight too, so that's something else to look for.
Thanks, Jenny. And now we're going to show you a method called baby-led breastfeeding. The idea behind baby-led breastfeeding is that babies want to breastfeed and instinctively know how. They just need a little help from mom. So now let's watch Heidi Brown as she breastfeeds her baby Trevor using the baby-led method. First, let's talk with Martha Kindle at her clinic. Martha, welcome. First, could you tell us a little bit about baby-led breastfeeding?
Sure, baby-led breastfeeding is a very natural process. It should be a peaceful experience for the baby and for the mother. It's also a great way to boost the mother's self-confidence and self-esteem.
Okay, let's take a look at our footage of baby-led breastfeeding, and you tell us what's happening.
As you can see, Heidi's skin is exposed around her chest, and Trevor is wearing just his diaper for some skin-to-skin contact. Heidi has laid Trevor on her chest, and they're just relaxing together. There he goes. He's starting to slide down, looking for Heidi's breast with his cheek. Trevor's almost there, but having a little trouble because his hand is in the way, and here's where Mom's help comes in. Now he's finding her nipple with his chin, and Heidi supports his bottom as he gets adjusted. And there, he's latched on.
That's it?
That's it. Some babies scoot down to the mother's breast, other babies sort of fall, and other babies actually throw themselves at their mother's breast. It's up to the baby to take the lead and for the mother to be there to help. Babies typically end up at a 45-degree angle.
Thanks very much, Martha. We'll have more on how to breastfeed after this brief message.
Oh, hey. How you doing? I'm fine, except for my dad pounding on my back here. Okay, that's better. So, yeah, I'm feeling pretty good. I just ate. Yep. Boy, do I love me some breastfeeding. My tummy is full, except now I gotta burp. That's what Dad's working on, getting me to burp. Sometimes I burp in this position, but not always. Dad usually pats me a little too hard, and then Mom reminds him to be gentle. So, yeah, Mom or Dad always burp me when I'm done eating, because I usually swallow air when I eat. Since my mom breastfeeds me, I don't always need to burp, but I like burping when I do it. Hey, what's going on? Oh, this position worked yesterday. We'll see. Now, where was I? Oh, yeah. If I don't burp after I eat, I could get air bubbles in my tummy. That gives me gas. One time, when my mom was getting ready to go out, she was in a hurry and she didn't burp me. My tummy started hurting a little bit, and then I spit up all over her dress. It felt so good, and I thought it was pretty funny. But she didn't so much. She said she didn't have anything else to wear, but you know what? I've seen her closet. She's got plenty of other clothes. Okay, here we go. Position 3. You see that towel? Dad puts it there so if I spit up, it doesn't get on his shirt. Finally. That felt good. Nothing like a good burp to make everything all right.
Welcome back to How to Breastfeed, our Health Bites News special presentation. Now we turn our attention to another aspect of breastfeeding, nutrition for the breastfeeding mother. What should a breastfeeding mother eat? For this, we'll visit the office of Dr. Charles Shaw, a university dietitian. Hello, Dr. Shaw, and thanks for joining us today.
Thanks for having me, Lisa.
So what can you tell us about a breastfeeding mother's diet?
Well, Lisa, good nutrition is especially important for breastfeeding mothers. Of course, that's because her body is making the most nutritious milk possible for her baby. Her body will burn a lot of extra calories to make milk, so it's really important that the mother eats healthy so she can replenish the lost nutrients. So again, healthy foods, not junk food, from all the different food groups in order to meet her body's needs and her baby's needs. Now, here's an example of some nutritious foods. Here we have some low-fat cheese cubes with whole grain crackers, half a cup of carrot slices, a cup of plain low-fat yogurt with a cup of fresh strawberries, and a small handful of peanuts. There's a lot of good nutrition here, but you may be surprised to learn that all of that has the same amount of calories as 3.5 ounces of potato chips like these. The difference is the chips have no nutritional value and are loaded with fat and salt. Foods with a lot of fat, salt, or sugar are not good for your health or your baby's health. Now, turning to drinks. Liquids are also very important. Breastfeeding mothers need plenty of water and other healthy beverages like a glass of fruit juice throughout the day. A mother should have a glass of water each time she sits down to breastfeed.
Dr. Shaw, I have a question for you. Is there anything women shouldn't have while they're breastfeeding?
Good question. Some babies may react to caffeine. It may keep them awake or make them fussy. In that case, women should cut back on the amount of caffeine they drink or just eliminate it altogether. As for alcohol, that passes into the breast milk, so it's not a good idea. That's something you should talk about with your healthcare professional. Mothers can eat just about anything in moderation, even chocolate and spicy foods. But if she notices that her baby gets gassy or fussy after breastfeeding, she should think about what she's had to eat, and she may want to cut back on that food while she's breastfeeding. Oh, and one other thing to note. Breastfeeding mothers are eligible for more WIC food benefits than formula-feeding mothers. WIC provides that larger food package to make sure breastfeeding moms get the nutrition they need.
Thanks very much for your insight, Dr. Shaw. That's great advice for breastfeeding mothers. Now we turn to a concern that many women have about breastfeeding, and that is the medications they take. While most medications are safe to use while breastfeeding, there are some that could affect your baby. This is something to talk about with your healthcare professional. You may be able to stop taking the medication or switch to something safer while you're breastfeeding. However, keep in mind that no illegal or recreational drugs are safe to use while breastfeeding. They can certainly harm your baby. Jenny, before we go, is there anything else breastfeeding mothers should know that we haven't touched on yet?
As a matter of fact, yes, just a few cautions. Lactation consultant Martha Kindle said that a newborn baby's stomach is about the size of an acorn, so it can only fit a few teaspoons of milk at each feeding. It's really important in the first few days that mothers do not give their baby a bottle of water or formula. That could stretch the baby's stomach too much, which would make him very hungry. When he's about 5 days old, his stomach will start to expand on its own, so feed him only from the breast during this time. A newborn should not have a pacifier either. He's just learning to breastfeed, and babies suck differently on the pacifier than on the breast, so it could affect his ability to breastfeed. Also, as a mom, you could end up with sore nipples.
Okay, great. Thanks, Jenny. Remember, if you have any concerns while breastfeeding, whether it's proper latching or any pains or infections in your breasts, or if you'd like to know more about baby-led breastfeeding, call your healthcare professional or your WIC office. They are always happy to help when it comes to breastfeeding your baby. Remember, breastfeeding is the one thing you can do for your baby to make sure he grows and develops normally and stays healthy. Breastfeeding really is the best feeding. Well, that wraps things up for this special presentation. For all of us here at Health Bites headquarters, I'm Lisa Miller, wishing you a great night and a better tomorrow.
I hope this section has answered your questions about how to breastfeed. To learn more, be sure to check out the rest of this section for fridge notes, other videos, and some fun games. And if you have remaining questions about other issues related to breastfeeding, take a look at some of the other breastfeeding sections of Health Bites.